Hi, this is Dr. Sriman Narayana, surgical gastroenterologist and laparoscopic surgeon, Renova Hospital, Sanat Nagar. Pancreatitis is the very common condition nowadays because of our habits like alcohol intake and smoking. So most common thing is the acute pancreatitis. So in acute pancreatitis, what is the meaning is the patient will take alcohol in the very recently, like in 3-4 days. He will complain of pain abdomen in the upper abdomen region, which is more commonly radiating to back. So more common, the patient will present it to the casualty with the pain abdomen, upper abdomen. Upper abdomen means above our navel, then followed by the pain will radiating to the back. That is also stabbing type of the pain will be there. This is the more common presentation of acute. Acute means is the sudden onset. The next common thing is the chronic one. Chronic, the meaning of chronic pancreatitis is the patient will complain of repeated attacks of like this, like a upper abdominal pain, back pain. That is a repeated attack with the history of chronic alcoholic intake or smoking intake. This is the more common for the pancreatitis causes, that is the alcohol intake and the smoking habits. And some patients have the gallstones also will cause this type of the pains. And repeated attacks of the pain will be there. And second thing will be the patient will have unanticipated weight loss. Patient doesn't want to go for weight loss program, but he has the weight loss. And the repeated vomitings will be there with a long history. And the motion problems also will come, like a loose motions with the greasy stools. And thing is the recent history of the diabetes. If this patient came with history of pancreatitis, we will call it as a chronic pancreatitis. Coming to the more common causes, what are the common causes of pancreatitis? In our India or in the world setup, the more common causes of pancreatitis is the alcoholic intake. Some people will say, no sir, I will take only the party basis, not in the regular habits. But we don't know how much alcohol will cause pancreatitis, how much times intake will cause the pancreatitis. Even 1 times of alcohol intake may causes the pancreatic attacks. Recent history of alcohol will be there and most patients will not be there also. So more common causes of pancreatitis will be the one is alcoholic intake and second one is the any history of trauma and third one is the any gallstones. Nowadays patient doesn't have the gallstones pain, but if you go for any elective or any normal general checkup for ultrasound scanning, we will identify the small gallstones. The presence of gallstones itself is indicate for the surgery because the gallbladder and pancreas is interconnected with the tubes, with the liver. Suppose any small stones in the gallbladder may slip into the pancreas, may causes the pancreatic attacks. The more common is almost 20% patient may get this type of attacks. So more common causes of pancreatitis will be the alcoholic intake and gallbladders. And some patients, both these conditions may not be there. Third one is the more triglycerides. That is the triglyceride levels more than 1000 may causes the pancreatic attack, but it's a very rare possibilities. And fourth one is the some family history will be there. For some families it will be continuous. That is called as familial pancreatitis. And fourth one is the anatomical disturbances. More common nowadays we are seeing is the annular pancreas or pancreatic division. That is the congenital anomalies. Even though we don't have any alcoholic, any smoking habits, this type of structural problem may cause pancreatic attacks. And as you know, some 10 to 20% cases we can't identify what is the cause. That is called as idiopathic. But mostly alcohol, smoking, more triglyceride levels, gallstones is the more common causes of pancreatic attacks.